morning, everyone. So, by the way, I'm Janine from Human Relations Department, and I will be your host today for our Wellness Wednesday webinar. Okay. So, as you all know, our government is requiring everyone to wear protective equipment in relation to the pandemic that we are currently in. And one of those is the face mask. Okay. So, as part of our Wellness Wednesday, so we will be discussing today the importance, benefit, and other details in connection with the effectiveness of using face masks to fight this COVID-19. Okay, so our host or our speaker for today is no other than the registered nurse, Safety Officer 1, Bosch certified, and our clinic and wellness lead here in Asia Premier One Source, Nurse Edlyn Joy Gaviola.
Hi everyone, good morning. So, welcome to our Wednesday wellness webinar. So, today I am your speaker. So, right now I have two pictures in front of you. So, on the left side, if you are facing the screen, it's gathering of people without wearing face masks. Kasi nga, before the pandemic strikes, ito yung ginagawa natin. We are having a lot of parties, a lot of gatherings. We have public activities na pwede nating gawin. However, when it comes yung dumating nga si COVID-19, hindi lang sa country natin, kundi sa whole world, everyone wearing face mask, which is on the right side. And aside from wearing a face mask, we are also mandated to have a social distancing for at least 1 meter for each other kasi nga we have to avoid the transmission. Now, our topic for today is related to face masks. So face mask, how face mask coverings help slow the spread. So kung nakikita natin, we have a lot of types of face masks. May mga trendy face masks pa with turbans. So let us dig deeper or let us understand kung paano ba tayo napoprotektahan ng face mask. So, amid the COVID-19 crisis, wearing face masks has become a way of protection from the virus. It helps slow the spread of virus when combined with everyday preventive action and social distancing in public places. So, on the picture, nakikita nyo, iba-iba yung mga itsura ng mga face mask natin. As what I've mentioned nga earlier na may kanya-kanya din siyang usage. So, wearing a face mask, we can say na effective lang siya when it has a filter. Number 2, it is not loose and properly worn. Number 3, it is not taken off outside with other people present. And number 4, it is breathable. So, ibig sabihin nakakahinga tayo ng maayos when we are wearing face mask. So we have to wear face mask correctly kasi nga yung iba nakikita natin merong mga lumalabas yung ilong, nakikita yung chin. So ano ba talaga dapat or proper way of or procedure on how to wear your face mask? So of course, number 1, we have to wash our hands before putting our mask. Kasi nga hand washing is a very effective way of killing the bacteria or washing off the bacteria, especially sa hands natin. Kasi nga, yung hands natin, pwedeng kahit ano-ano yung hinahawakan natin, lalo na if we are in public places. And number 2, put it over your nose and mouth and secure it under your chin. So ito yung magiging itsura niya dapat. And then number 3, try to fit it snugly against the sides of your face. So ayan, kailangan hindi siya loose, kailangan snug and fit siya. And then number 4, make sure you can breathe easily. Kasi merong mga face mask na sobrang higpit naman. And then, as per CDC, CDC does not recommend use of mask or cloth mask for source control if they have an exhalation valve or vent. So yung may makikita tayong mga valve. So hindi siya recommended talaga. Types of face mask. So number 1, N95 respirator. So this face mask, commonly used siya ng mga healthcare workers who are in need of a higher level of protection. So katulad ng mga infection control department, yung mga infectious nurse, yung nasa CDC, so they are using N95 face mask. And then yung filter niya naman, higher yung filtration niya than the regular face mask. Makafilter siya ng estimated 95% of airborne particles. So, yung mga viruses din, kung gaano siya kaliit, nafi-filter niya din through the N95 face mask. Next is KN95. So similar naman siya ng N95 respirator. However, ano siya, disposable to, yung KN95 natin. Yung fit niya is tightly naman around sa face, and itong KN95 ano siya, one size fit all siya. So wala siyang specific sizes sa mga tao na gustong gumamit ng KN19. And then also it also filters, same sila ng filtration ng N95. Surgical or procedure mask, so ito yung nakikita natin or usually ginagamit talaga natin sa nowadays. And then FDA-approved surgical mask made of disposable mask nga siya kasi one-time use din yan. And surgical mask is not as tight or fitted as N95 and should be able to be tolerated easily. So hindi siya ganun ka-tight unlike sa N95 at saka sa KN95. And then this mask will be worn by our healthcare workers who provide direct patient care. So let's say if you are not healthcare provider naman or healthcare worker, you can use this para to protect yourself, at saka yung filtration niya kasi hindi siya ganun ka hindi tayo, in short, hindi tayo mahihirapang huminga unlike with the KN95 at saka N95. So advisable din siya sa mga sickly person and yung mga low yung immune system at saka yung may mga cancer patients. So ginagamit yung surgical mask. And of course, katulad ngayon during the pandemic, ito yung nakikita natin na sinusuot talaga ng mga tao mostly. One-ply cloth mask. So cloth mask siya. Okay siya sa general public. They are on the mask which can be washed. Yun nga lang, yun one-ply cloth mask natin is wala siyang filtration kasi nga one-ply lang, manipis siya. And then two-ply cloth mask, ito yung cloth pa rin siya. However, meron siyang second layer of protection na pwede mong lagyan ng filter or pwede mo siyang lagyan ng tissue. Kaya lang may challenges lang din if maglagay tayo ng tissue. Kasi nga sa tissue, hindi talaga nagkakaroon ng tawag nito, hindi ka nakaka-inhale masyado ng hangin kasi nga yung yung particles ng tissue is compact siya. Solid siya yung um, component ng tissue. So feasibility and adaptation. So CDC recognizes that wearing face masks may not be possible in every situation or for some people. So in some situations, wearing a face mask may exacerbate a physical or mental health condition, lead to a medical emergency, or introduce significant safety concerns. So like the chronic obstructive pulmonary disease or yung may mga lung diseases. So may specific lang sila time na pwede silang magsuot ng face mask kasi lalo na pag expose sila in the public, of course they have to, pero pag nasa bahay sila may times na pwede sila, may times din na hindi kasi nga lalo na pag low yung immune system nila, and then yung mga tao na yon they are closely monitored by their doctors. So itong face mask na to, I discovered this na hindi lang pala siya pang pakita ng lipstick. So I thought it's for the lipstick. However, as we dig deeper on the research, itong face mask pala na to, intended siya for the hearing impairment or yung mga taong may problema sa pandinig kasi they used to lip reading for communication. So ito yung gagamitin mo if may kausap ka na bingi kasi they can do lip reading. Para at least yung communication mo effective pa rin even though you are wearing face mask. So ito naman, may mga bata or may mga individual na intellectual and developmental disabilities naman. So may mga mental health condition ang mga yan. So may mga hindi nakakasuot ng face mask. So we have to assist them. Of course, kailangan hindi talaga yung pang KN95 or 95 yung gagamitin na sa kanila. Surgical mask will do also, and also two-ply mask kasi nga katulad nitong batang to, nasa wheelchair siya and he cannot help himself. So, yung isang kamay na nagpapasuot niyan is yung nag-aalaga sa kanya para at least kahit kung lalabas siya, kung may mga check-up, then there is someone can help him or her to wear face mask. For young children naman, so for preschool or elementary age, meron din silang face mask intended for them. Ayan, so kailangan proper mask size and fit siya. So, hindi pwede gamitin yung pang-adult, so meron talagang pang-kids. So of course, when you are having activities that may cost magiging wet yung mask mo, so hindi talaga siya po pwede. Kasi nga, when it comes to lalo na sa swimming, kailangan ng breathing niyan. So, pag naka-face mask ka, hindi ka makakahinga talaga ng maayos. So, hindi siya po pwede. And if you're engaged in high-intensity activities like jogging, marathon, may mga activities pa na outside, so hindi ka po pwedeng mag-wear ng mask kasi yung oxygen level mo and your lungs needs to work kasi nga kailangan mong mag-inhale, mag-exhale properly. So, kung magmamask ka pag tumatakbo, so napapansin nyo if nagmamadali kayo, if papunta na kayo sa work and tumatakbo kayo, nahihirapan kayong huminga, it's because yung oxygen level mo is mababa because of the mask blockage naman ng mask. So, if you are unable to wear mask, so kailangan yung activity na sa public and ventilated yung location natin, and we can also have a proper breathing and makakaroon tayo ng magandang air exchange. Kasi nga, pag mababa naman yung oxygen level ng katawan natin, there's a tendency makaka-encounter tayo ng dizziness, headache. So that's why yung mga activities na ganun, kailangan in public talaga siya. So 5 mistakes to avoid with your mask. So number 1, not washing your hands. So sometimes sa atin kampante na tayo, hindi na tayo naghugas ng kamay before wearing our mask. So kailangan hugasan muna natin kasi ilalagay natin yan sa mukha. Number 2, not covering your nose and mouth. So there's a tendency, kung accident naman na natanggal, so we have to return it. Pero of course, kailangan natin hawakan yung mask natin, lalo na ngayon, yung filtration na sa labas. So yung filtration na yan, so lahat ng mga dust, mga particles, mga bacteria, nasa mask na yon. So, and mistake number 3, touching or adjusting our mask. So, kailangan hindi talaga pwede natin gawin yon kasi nga, natatouch natin yon. So, there's a tendency na yung bacteria lilipat sa kamay natin. So, mistake number 4, masking too late, removing it too soon. So, sometimes may kausap na tayo, saka pa tayo nag ng mask. So, minsan naman, pag may nagsasalita na nakakalimutan natin, natatanggal natin yung mask, and meron namang iba, although kayo dalawa lang, pero sobrang kampante siya sa sarili niya, tinatanggal niya din yung face mask niya. So wherein, in times of pandemic ngayon, hindi po pwede talaga tayong magtanggal ng mask, lalo na pag may kausap tayo at enclosed tayo sa isang room. And then, mistake number 5, reusing old or dirty mask. So pag dumihan na yung mask, natanggal na yung mask natin, and nagamit na natin siya ng long period of time, kailangan i-dispose natin siya properly. These are the do's. Choose masks that have 2 or more layers of washable or breathable fabric. Completely cover your nose and mouth, and then fit snugly against the side of your face and doesn't have gaps. Supposedly wala siyang gaps dito kasi pwedeng pasukan din kasi ito ng air. So, kailangan nakakover talaga siya. Do not choose masks that are made of fabric that makes it hard to breathe, or example, vinyl. Meron pa yung ibang mask na yung foamy, yung sobrang kapal. Minsan nahihirapan tayong huminga dyan. And then have exhalation valves or vents which allows virus particles to escape. So, yung may tendency na yung may valve, um, natatanggal kasi yan minsan so may butas yan. So, nawawala yung essence ng pagsuot din natin na mask. So, na-expose tayo. And then ito are intended for healthcare workers including N95 respirators or surgical mask. So for normal people naman, surgical mask will do or 2 or more layers of washable or breathable fabric. Pwede na yun. Yung N95 and KN95, highly recommended talaga siya sa mga healthcare workers. And if ever yung medical condition mo naman is really susceptible ka, let's say cancer patient, sometimes pinapaware ng mga doctors natin lalo na pag sa hospitals, expose siya sa hazardous event or hazardous na location or area. So I have here a short video. It's how to wear a mask naman. This is from CDC. Short video lang talaga siya. So, yun yung mga diniscuss ko earlier. So, how to wear a non-medical fabric mask safely? So, of course, number one, you have to wash your hands and then inspect the mask for damage or if dirty. And then adjust the mask to your face without leaving gaps on the sides. So, cover your mouth, nose, and chin. So, make it sure talaga covered siya. Avoid touching the mask and then clean your hands before removing the mask. And then remove the mask by the straps behind the ears or head. So, dito tanggalin mo talaga siya. And then put the mask away from your face and then store the mask in a clean plastic resealable bag if it is not dirty or wet and you plan to reuse it. Pero yun nga, pag surgical or disposable mask siya, automatic tatapon siya. Pag fabric naman, of course, kailangan linisan mo talaga siya before you store it. Remove the mask by the straps when taking it out of the bag. When the mask in soap or detergent, preferably with hot water at least once a day. So, pwede mo siyang isok sa hot water or exposed to direct sunlight. Mas nakakatulong din yun. And then clean your hands after removing the mask. So, how to wear a non-medical fabric mask safely, pero ano yung don'ts? So, do not use a mask that looks damaged. So, pag damaged na siya, automatic discard or itapon nyo na siya. And then do not wear loose mask. So, pag medyo maluwang na or hindi na siya fit sa atin, so automatic discard yon. So, do not wear the mask under the nose. So, minsan yung iba sa atin, binababa yung mask kasi nga nahihirapang huminga. So, kung tatanggalin mo siya na again automatic, tanggalin mo na siya lahat. Palitan mo na lang siya ng bago. And then do not remove the mask where there are people within 1 meter. So of course, ayan, so yung transmission iniiwasan talaga natin. So highly recommended talaga na huwag tayong magtanggal ng mask pag may mga tao talaga or nasa public places tayo kasi hindi natin alam kung sino-sino yung mga nakakasalamuhan natin at kung saan sila nanggagaling. And then do not use a mask that is difficult to breathe through. So pag nahihirap ang huminga, hanap ka ng ibang face mask na will help you to breathe easily. Do not wear a dirty or wet mask kasi nga pag wet, yung bacteria nakaka-harbor siya or gustong-gusto nila yung wet or dirty na mask natin. And then do not share your mask with others. Of course, hygiene na lang natin. Hindi talaga pwedeng mag-share ng mask. So ito naman from DNR on how to dispose aside from face mask, mga PPEs natin. So mga used masks from hospitals, barangay health centers, and clinics are considered hazardous yon. So infectious waste siya sa medical term. So it should be treated in accordance to the implementing guidelines of DNR Administrative Order Number 22-2013. The handling, transport, and disposal of such shall be carried out by transport, storage, and disposal facility. So may specific disposal talaga tayo. As a precautionary measures, also use masks from households with persons under investigations or persons under monitoring should be treated as hazardous also as well and must be segregated into a separate bin or trash can prior to collection by TSD facility personnel or crew. Furthermore, use masks from offices, workplaces, and homes without PUIs and PMs may be treated as residual waste. Thus, it must be stored separate lang siya collected by eco-aids or garbage collectors equipped with personal protective equipment PPE and be disposed into category 3 or 4 sanitary landfill accordingly. So kung napapansin nyo, meron tayo dito sa office na may specific trash cans yung face mask natin. Aside sa face mask, includes yung gloves at saka yung tissues. Kasi nga, pwede siyang matreat as hazardous waste, lalo na yung may mga symptoms and lalo na yung mga taong tawag nito, exposed din sa um, positive or sa mga suspect patients. So always be careful. Face mask can cause difficulty in breathing, especially to people with chronic respiratory diseases or may already have breathing difficulty. So as what I mentioned nga earlier, and then children 2 years old and below, kasi yung mga batang yan, mga mostly sa kanila is mouth breather. So nahihirapan silang huminga and they are still on the process of learning on how to breathe through nostrils. So medyo may difficulty talaga yung mga batang yan. And then hindi sila po pwede dun sa mga makakapal na mga face mask. So anyone who is unconscious, incapacitated, or otherwise unable to remove the mask without assistance, so of course, high risk sila to have a difficulty of breathing kasi nga wala silang capability of removing it.
Nurse Edlyn, do you have any additional reminders to our APOSI community or even dun sa mga external viewers natin or listeners for this wellness um, webinar, especially in line
Actually,
with this pandemic?
yeah, I have an additional information pala. Kasi mostly yung mga tao or even me before, na nalilito ako nito on how to use the surgical mask. Kasi 'di ba may two colors yung face mask natin. May white
Alright.
and
Yes,
may
totoo
blue,
yan.
may white, may violet, may mga iba-ibang color yon. So, during the pandemic, kailangan yung blue or yung the filter itself or anong color yon, dapat yun ang nasa labas. Kasi it will filter the bacteria, the viruses, the dust against us. So, ibig sabihin hindi tayo magiging exposed doon. Now, if you are sickly person, mababa yung immune system, meron kang allergic rhinitis, meron kang cough, or may lung diseases ka, baliktarin mo yung mask. So yung filter is nasa loob siya, and then yung white is nasa labas. Kasi yun naman yung pangharang natin to transmit to other people naman, sa mga healthy people. Yun.
Yeah, kasi ano, no, ever since the pandemic started, or maybe even wala pa yung pandemic,
Mm-mm.
um, especially for those persons na nagkakasakit, they keep on asking what's the correct way of
Oo.
wearing the mask. So if you're sick, especially during these days, so yung blue, yung colored one should be dun sa
Sa
nakaharap sa
loob.
face, sa loob. And
Yes.
then if hindi naman, so
Sa
it's more
labas.
of your protection from external, like ano, I don't know, virus or yung mga
Mga
makakasalamuhan mo.
bacteria, yung mga
Yes.
gano'n.
So it should be outside.
Yeah,
So guys, is it clear now? So I know yung mga viewer or listeners natin dyan, that's their question then for quite some time. Okay, so yeah, so thank you everyone for attending this wellness webinar. So this minimum health standards discussed by Nurse Edlyn and of course being mandated by the government will be the backbone as our response to COVID-19 outbreak or this pandemic. Okay, so of course, as employees and Filipinos in general, we all have our responsibilities to our community to stop the spread of this disease. So, in line with this new normal, let's make sure that whenever we will be going outside or you'll be attending some meetings or you'll be in a closed areas and there are other people, so make sure to wear protective equipment such as the face mask and of course right now required na din will be the face shield. So thank you everyone for joining us today in this wellness webinar brought to you by Asia Premier One Source.